Hi everyone, welcome and thank you for joining us. My name is Corey Burford and I'm the Managing Director of SkyTrust Risk Management Software. With me, I also have Mary Nizamis, our Business Relationship Manager. We are excited to be the Platinum sponsor for this event and equally excited to partner with our SkyTrust partner, FIFO, and introduce Kate Power, Director, and Sally Boucher, Senior Consultant. Between Kate and Sally, they have extensive qualifications and experience in the mental health and wellbeing space. SkyTrust and FIFO have a collaboration of bringing our specialised expertise in risk management software and their risk and safety consultancy expertise together to help businesses in achieving their compliance and corporate goals. Welcome, Kate and Sally. Thank you for joining us today and providing us with an insight into your experiences and this very important topic of a risk-based approach to mental health and wellbeing.
Thanks, Corey. Thanks, Mary.
Thanks. Hi, everybody.
If you have any questions, please use the live Q&A session or discussion forum for the chat. And so, Kate, in your experience, what are you seeing as the current trends in mental health and wellbeing?
So, Corey, we're very much aware that COVID fatigue has set in well and truly. We're seeing increased reports of isolation, job insecurity, loss of jobs, financial insecurity, casualised workforce with no sick leave, and emerging of work and home life. What's that resulting in is an increase in contact with mental health services such as Beyond Blue and Lifeline. We've had a Black Dog survey released this week surveying 5,000 people, and 78% of people surveyed reported a deterioration or a worsening of their mental health since COVID lockdown. We've had Professor Ian Hickey is reporting that they're expecting an increase of 25% of suicide rates year on year for the next 5 years in regional and rural parts of Australia. And also, concerningly, we've had an increase around domestic violence rates in terms of the percentage of urgent requests for assistance and online research. We've also had an increased number of children presenting to hospital relating to DV incidents in homes. Concerningly, and certainly a flag for organisations, we've just had the New South Wales Court of Appeal has determined that a lady who was working at home and sadly murdered in the home while she was undertaking work, that event has been deemed work-related. Work was a significant contributing factor and thus compensable under the Workers' Compact. So we're seeing a real merging of those worlds in terms of work life and home life.
So, Kate, as an organisation, how can we best manage these trends?
Yeah, so there's, Terry, if we can go to the next slide, thank you. So in terms of what we're doing at FIFO, we use the GROW model, which is a process, goal and project management model to assist our clients to better understand their risk from mental health and wellbeing perspective and provide data-driven and evidence-informed practical mental health and wellbeing strategies. We deliver that through conducting psychosocial surveys, data and trend analysis, for example, of EAP, workers' comp and employee engagement surveys. We combine that along with mental health and wellbeing bow tie workshops once we've got that initial round of results. And from there, we're able to delve into understanding what are the demands on workers and on teams in terms of things like group and task conflict, perception of procedural fairness within teams and within structures within organisations. And from there, we look at what are the resources available to individuals and to teams in terms of mitigating those worker demands. From there, we're able to look at the psychosocial outcomes. So we're talking about things such as increased reporting of sleep disturbance, at-risk behaviours increasing, such as drug and alcohol consumption, increase of bullying, reports of bullying, job burnout and sick leave rates. So bringing all of that together, we're able to deliver a risk-based, data-driven, psychosocial organisational team and business profile, which gives us a really comprehensive strategy and roadmap to drive down mental health and wellbeing risks for organisations.
Okay, so thanks for that, Kate. So I'm just going to take you through this slide, which shows the results of some detailed analysis work that we did pre-COVID with a group of first responders. And what this case study will do is bring alive what Kate has just explained. And you can see pretty quickly that that's some sobering data there. On so many indicators, this group of workers is experiencing significant distress and poor outcomes, group conflict, sleep disturbances, pain, bullying, job burnout, increased intention to take sick leave. Now, you could jump to the conclusion that each of these indicators dictate a need for individual solutions, devising a suite of programs and services which address each of these issues individually. So you could come up with a sleep hygiene program, a bullying and harassment program, a mental health awareness program. Or, as we did, you could drill down further and explore the causal factors and interconnectedness of these worker outcomes. What we found in this case is that exposure to trauma is the link. Bullying, sleep disturbances, job burnout, and etc. are all connected back to that exposure and are manifestations of unhealthy coping strategies. So the assessment finding here was to build a program which gives first responders and their supervisors the knowledge and tools to effectively process the challenging events that they're exposed to, and to know when and how to get assistance early if they're struggling. It's only if you take this approach of using evidence-based tools, research data and expertise to identify and drill down into these issues that you're going to get to the bottom of what's going on for workers. It's then that you can design programs and interventions that effectively address the core issues and stimulate real and lasting change.
Thanks, Sally. And what happens if an organisation fails to act?
Well, if we fail to act, the rates of mental illness, self-harm, suicides and family violence will continue to escalate. The direct costs of absenteeism and compensation claims for psychological injuries will continue to rise without a focused and effective approach to mental health and wellbeing in the workplace. Some recent research by the Black Dog Institute revealed that 50% of managers believe that no one in their work group has a mental health issue. Given that we know 1 in 5 adult Australians have a bout of poor mental health in any given year, we have a significant disconnect at the moment between the perception and the reality, and we really need to address that. We know that when we optimise people's mental health and wellbeing, we're also optimising their performance capabilities, and that has obvious benefits for any organisation's bottom line. Not addressing these issues also goes to worker retention. Workers are discerning. If they don't feel understood, valued and supported by their employers, they will take their knowledge and skills to organisations who have a reputation for respecting and looking after their people. Organisations that don't have effective programs also miss opportunities to make significant contributions towards their corporate social responsibility. If we build targeted, effective mental health and wellbeing programs in the workplace, the flow-on effects to individuals' professional and personal lives, to their families and the community are immense. And I think organisations have an opportunity to be recognised for their part in lifting the outcomes in this space. Thanks, Corey.
Thanks, Kate and Sally. That was very informative. And I'm sure that our audience has gained some valuable insight into the value of taking a risk-based approach to mental health and wellbeing. You've provided some clear guidance in how to establish and embed programs and systems to prevent and reduce mental health and wellbeing risks in their workplace. If you have any further questions or would like to connect with Kate or Sally, please feel free to contact them direct. Or if you'd like to find out more about SkyTrust, feel free to reach out to us. Now, there have been some questions that have come through. We will respond to them due to the time constraints individually. But as I said, do feel free to contact us if you need to. Don't forget also to go to the Spotlight presentation and get more information on FIFO's Grow model and how SkyTrust as a cloud-based risk management platform can help you manage your risks in your workplace. That ends our session. Thank you everyone that joined us and have a great afternoon. Bye from the SkyTrust and FIFO team.
Thanks everyone.